Good morning, I'm Natalia V, and your MC for this forum. I want to warmly welcome you. I want to warmly welcome everyone to session 3 of our forum, which will discuss the topic of leaving no one behind, human well-being and health. This session is co-organized by ESCAP, UNESCO, UN Women, and WHO. First, some brief housekeeping announcements. Please note that this forum is bilingual, English and Russian. You can select the language you want to listen to by clicking on the respective interpretation channel. On behalf of our interpreters, I want to inform you that our interpreters will alternate every 20 minutes. Speakers and participants are requested to be mindful of the additional difficulties experienced by interpreters when working in remote mode, and of the increased likelihood of disruptions to the audio feed to the interpreters. Only the speech or interpretation in the original language constitutes an authentic record of the proceedings. Interpreters servicing remote meetings cannot be held liable for interruption of service, pixelation, freezing or loss of visual input, partial or complete loss of audio, audible artifacts, unauthorized access to personal or confidential data, leaking of information due to inadequate soundproofing, and or data loss. Participants joining us on YouTube live stream can, throughout the session, post questions on the YouTube chat. Our colleagues will select and forward some of your questions to the moderator. Those questions we have no time to answer, we will answer in a summary format in writing later and post this onto our ESCAP forum webpage. With these housekeeping announcements out of the way, I now would like to give the floor to our moderator for the session, Mr. Srinivas Tata, Director, Social Development Division of ESCAP. Mr. Tata, the floor is yours.
Thank you very much, Natasha. And thank you. I welcome you all again. In addition, reiterating Natalia's welcome to the session 3 of this extremely important, the 4th North and Central Asia Multi-Stakeholder Forum on implementation of the SDGs, especially in the post-COVID-19 period, during and after the COVID-19 crisis, considering it's an ongoing crisis. This session will focus on human well-being and the SDGs and how what would be the best way for the region as well as the North and Central Asia sub-region, the Asia-Pacific region as a whole and the North and Central Asia sub-region to recover after the COVID-19 crisis. This session will, of course, focus on 3 major issues. One, we expect that it will discuss human well-being in terms of quality and access to basic services such as health, education, and social protection. It will look at the direct and indirect impacts of COVID-19, especially on vulnerable groups. And it will highlight the importance of leaving no one behind from COVID-19 recovery to long-term inclusive, resilient, and sustainable development. I just wanted to provide you a little backdrop of the key issues that we need to address, knowing fully well that we have brilliant presenters from WHO, UN Women, and UNESCO who will be highlighting key issues. But I wanted to give you the broader perspective under which we are really organizing this forum and perhaps some of the key issues that we need to keep in mind. Can I have the presentation? So as you can see, can I have the presentation on the screen, please? Yes, so the slideshow, if you can, start off. Okay, the next slide, please. Next slide, please. Yes. As you can see, we are focusing on issues of older persons and persons with disabilities. We'll be looking at health impacts. We'll be looking at gender equality and women's empowerment, and also on education and youth empowerment. And we hope that we will look only on really be able to focus on the issue of leaving no one behind. Next slide, please. You see, even before the COVID-19 pandemic, the North and Central Asian sub-region was not fully on track to achieve the Sustainable Development Goals. As you can see, there were certain goals on which it was doing well, certain goals on which it was making slow progress, but certain goals on which it was actually regressing. And so now with the COVID-19 pandemic, we obviously these trends are going to be even more. The progress towards the SDGs will be even more challenged and will need redoubled efforts from countries within the sub-region. Next slide, please. Yeah, I would like to focus on some of the key vulnerabilities or some of the groups that we will be referring to throughout this conversation. In the Asia Pacific region as a whole, I want people to note that persons with disability face increased vulnerabilities as compared to the general population, which is the persons without disabilities. Poverty rates are 3.9 to 20.6% higher amongst persons with disability as compared to persons without disability or the general population. Persons with disabilities are on an average 2 to 6 times less likely to be employed than the general population. Representation in national parliaments is only 0.4% across the region. Coverage in government funded benefit or social protection disability benefit programs is as low as 28% when you take the coverage across the region. At least one third of children with disability do not receive any early intervention services, which are so vital, including preschool education, which would really help them prepare better for better integration into society. Access to reproductive health services is 2 to 3 times lower for women with disabilities as compared to the general population. Next slide, please. Again, focusing back on the North and Central Asia sub-region, the sub-region has countries which are considerably progressed in the process of population aging, and some relatively younger countries. So, from that perspective, I think but I think every country within the region will be aging very fast as we look ahead. And though the proportion right now varies from less than 5% to 15% in terms of population over 65 years of age, the process of population aging doesn't spare any country in the region, and countries need to be prepared to really address the needs of a growing number of older persons. A little labor force participation of older men and women, for example, as you can see, varies across the different countries. And this is data from a selected group of countries within the sub-region, and it varies across. Now, there are many factors which determine labor force participation of older men and women, some of which is availability of social protection schemes, but also the desire of older persons sometimes to stay active. So, taking into account, we have different rates of participation of older persons in the economy or in the labor force. Next slide, please. Again, one of the key issues relating to youth, a significant proportion of youth, and my colleague from UNESCO is going to cover this in great detail, is not in education and employment or training. And they have been, again, particularly affected by school closures resulting from COVID-19. So you will find these ratios perhaps even more affected and a greater impact on youth, which I hope will be covered in later presentations and by the panelists. Next slide, please. Now, we also, if you look at the digital divide in the sub-region, this is more by age. I mean, the men-women differential is perhaps less, but significant disparities in the access, you see, in access to internet, in access to mobile devices, in terms of older persons having a much less rate of access and coverage as compared to the general population. And this has significant implications considering the new normal, where we are doing a lot of, we're offering services and information is being shared using internet. And this digital divide may actually influence the way we actually address the needs of older persons. So just wanted to illustrate some of the key issues that we need to keep in mind. And just looking at the percentage of internet users, you can clearly see older persons are using it far, far less than the general population. Next slide, please. So, as you know, the digital divide exacerbates social exclusion of vulnerable groups, particularly in the wake of COVID-19, in terms of access to information, access to telemedicine services, which are increasingly being adopted. And you know that digital services can alleviate social isolation and loneliness. So, if you do not have access to the internet, you will lack the access to this very vital service. And e-services in general are something that cannot be offered or cannot be accessed by older persons if they do not have access to the internet. Next slide, please. Next slide. Yes, I just wanted to show you some of SCAP's analysis that was based on how COVID-19 has made some population groups more vulnerable. And we're looking at women, older persons, and persons with disabilities. We've done that with other groups, but we are focusing on these groups because this is the focus of our discussion today. Now, in terms of increased risk of infection, we know that maybe in terms of death rates, men have had the slightly higher percentage, but that does not mean women are not more vulnerable. 70% of workers in social and health sectors are women, and that makes them far more makes them at the increased risk of infection. So, in terms of from that perspective, women are as or more vulnerable than men. Older persons, we all know that they have a higher morbidity rate due to underlying NCDs and other issues. So we have a disproportionately higher mortality rate also amongst older persons. Persons with disabilities have also suffered. Social distancing has been difficult. They have had a problem in distancing themselves from the support services, from support persons. During the lockdown, we all know that gender-based violence has increased. We know that older persons suffer isolation and abuse, and this has increased. Anecdotal information indicates that in conditions of lockdown and stress conditions, this has also increased. And for persons with disabilities, we all know how essential support services have been made far more difficult for them to access. The immediate socioeconomic impact, loss of jobs due to unpaid care responsibilities, has been far more in women. Survival for older persons, we have a large proportion of older persons in the region who don't have access to pensions. They're dependent on savings and handouts, and they have really been badly affected. Persons with disabilities, as it is, they are lesser employed, and they have lost jobs far more, and the rate of unemployment has grown in persons with disabilities. Access to health services, sexual and reproductive health services has been difficult to access for women during this time. Similarly, for older person treatment for NCDs and other health services, they have avoided going to hospitals, which has given rise to breaks in treatment, and also they have not addressed other critical conditions. And for persons with disabilities, they have lacked access to prescription medicine, respirators, and oxygen tanks. Next slide, please. So we hope that this discussion is going to address the following questions. What is the impact of the COVID-19 pandemic and the related crisis on pre-existing inequalities, and what does this mean for the mid and long-term future of the different vulnerable groups? Can we look at existing systems of social protection and social services in North and Central Asian countries? How were they able to respond to the COVID-19 crisis? What were their strengths? And what are the key lessons learned and priorities for looking ahead? We have seen the risks of the need to achieve toward the SDGs, and what are the innovative and workable approaches that will help put countries back on track for achieving the SDGs in the post-COVID-19 era. So that is my presentation as to the key issues and to lay out the bigger issues. So this ends my presentation, and I now have the pleasure of going to our first distinguished panelist. Our first panelist who will speak with the WHO representative and the head of the country office in the Russian Federation, Ms. Melita Vuyanovic, Dr. Melita Vuyanovic, I conclude. As we know, COVID-19 pandemic is first and foremost a health crisis. Of course, it's blossomed into this multi-sectoral economic, social, and health crisis. So we would like to start today's discussion with a presentation of what lies at the core of this pandemic and how health impacts are differentiated and can leave vulnerable groups behind. So I'm delighted to welcome Dr. Melita. The floor is yours, Ms. Melita, to give a presentation on the situation and impacts of COVID-19 in the NCA region. Ms. Melita, the floor is yours.
Good morning. I hope you hear me, and I hope, yes, you can see me as well. Thank you very much for inviting the World Health Organization to this session, which is symbolically the session number 3, but also, I would say, the same number as the Sustainable Development Goal number 3, which is good health and well-being, that we would like to speak today. And allow me to start with this head title slide, which is showing what COVID has actually caused for people at the peak of the pandemic. This is a photo of the metro in Moscow during the peak of the pandemic. We are in unprecedented time when everything that we knew, the normal, has changed, and we do not know how long it will last, how many times we are going to see a resumption of the infection that has caused huge changes in our everyday understanding of life. Next, please. Next. When we are talking about health in the era of sustainable development goals, we would like to say that health we see both as a precondition, but also as the outcome of sustainable development and a driver that can drive the entire world and society towards achievement or disachievement of the goals that we have jointly identified as critical for a sustainable and resilient future. And this mutual interrelation between health and all other goals is critical, because achieving health and well-being, looking at the other socioeconomic determinants and issues, and looking how health is contributing to that, is actually part of what you have so clearly, Mr. Tata, explained in the introductory presentation, which is why vulnerabilities, why inequalities exist, and how can we address it. It's not just more medicines or more health services. It is a much profounder three-dimensional matrix that we have to look at. And it is the multi-sectoral collaboration while enabling us to address all the needs of one person, because the system needs to be putting centrally the individual, the human being, to ensure that no one is left behind. Next slide, please. I have here placed the targets and indicators of the Sustainable Development Goals. What we like to say is that these are goals within the goals, and highlighted in red those targets that we already have seen strong indications that will be further affected by COVID. While, of course, maternal and reproductive health services were the ones, because of their acuteness, that have been protected more or less. Still, maternal mortality in relation to pregnancy, in relation to reproductive health planning, to abortions, and to birth have been variously affected in various countries, disproportionately more in countries which have lower income, and disproportionately more in population groups which have lower income. The same is for the deaths and the life of newborns and children under 5, because while data are still not available, we do fear that this impact will also disproportionately affect those who already face inequities. The epidemics of AIDS, tuberculosis, not so much relevant for this sub-region, but relevant all over globally, malaria and other tropical diseases, hepatitis, waterborne diseases, will be definitely showing what the impact of COVID was. And COVID as a communicable disease has entered into this goal very strongly. So the overall situation with the current mortality, at the moment when we have tens of millions of persons being diagnosed, confirmed, and probably an equal number of undiagnosed at the moment from the start of the pandemic, is unprecedented challenge for the humanity. Goal 3.4, the burden of non-communicable diseases and mental health, which have been the main cause of death for many, many countries, both those with lower income, middle income, but also in higher income countries. And the divide in life expectancy at birth and quality of life, especially for the elderly, it's the target 3.4. And we already knew before the pandemic started that in the Central Asian region and some countries, but also globally, out of these sub-targets for non-communicable diseases, many have not been on track. With the analysis, we will show that we already see signs that due to COVID, both due to the burden and disproportionate COVID disproportionately affecting people with underlying conditions of non-communicable diseases, but also because of lockdown, overwhelmed health services, and repurposing to address the needs of COVID, we are fearing to see a growing burden of mortality and probably disability due to non-communicable diseases. Treatment of substance abuse, including narcotics, drugs, and abuse and harmful use of alcohol, while some countries have been achieving quite good results, again, during the lockdown, we already have insights from behavioral insights where people were themselves reporting a higher percentage of use of alcohol during the lockdown. Next slide, please. Next slide. Looking forward, it seems that there is one goal that in some countries has shown a decrease in terms of the lockdowns. That was the global deaths and injuries from road traffic accidents. But that is doubtful because we have to see how the entire period of lockdowns and release and the post-lockdown periods are actually affecting the global deaths and injuries from road traffic accidents. Further on, the universal access to sexual and reproductive health care services, including for family planning, we already know is suffering. And finally, very important to say, what is in the basis of the WHO Global Program of Work, one of the 3 billion targets that WHO is promoting, universal health coverage, not only to health services, but to health promotion, to palliative care, to rehabilitation, to healthcare services, including financial risk protection from use of health services, access to quality, adequately quality essential health services, and access to safe, effective, quality, and affordable essential medicines and vaccines are highly challenged with the COVID. Because while the world is striving to make available the sources and resources for healthcare services for COVID, this has inadvertently affected all other essential health services. We have, of course, looked at the immediate effect of COVID and the lockdowns on target 3.9, looking at chemical and air, water and soil pollution and contamination, especially with regard to air pollution, which has dramatically decreased in the periods of massive lockdowns in certain countries. However, with the resumption we are seeing a worrying trend that the situation is getting worse. Thus, we have to very carefully look at how the targets 3.9 will not be fully affected because of the situation that we are seeing. For example, after the lockdown in major cities, people afraid of using public transportation have reverted to higher use of individual vehicles. So any, so to say, good effects of the lockdown have been fully lost with the easing of lockdown, which is necessary to restore the new normal. Next slide, please. Next slide. Of course, we are seeing the underlying instruments. I will not comment too much on them, but it is actually the health system components that we are looking at and that we need to address for building back better. Next slide, please. Let us start and look at what is actually the burden of COVID directly on health due to the illness. And you can see the global situation. It is more than 25 million cases as of yesterday, and it is more than 852,000 deaths that have been confirmed. We do fear that these numbers, as we have said, are higher and they are growing. You can also see the WHO regions and how they are affected. Leading is the Americas with more than 13 million cases, Southeast Asia, more than 4 million cases, closely followed by Europe with almost a similar number. Eastern Mediterranean and Africa show lower numbers at the moment, but we also fear that the numbers might be higher there. So the Western Pacific region has somewhat lower figures, and we are trying and looking into this region also for good practices. Next slide, please. Next slide. This is the situation in the WHO European region, 53 member states, but you can clearly see the part of the region which we are referring to as Central Asia, and then, of course, the Russian Federation. The current situation is more than 4 million cases in Europe, more than 220,000 deaths. Russia is the highest affected number in terms of confirmed cases, more than 1 million cases. The mark has been passed the last days. However, the number of deaths is only 17,000. And this is something that we have to look into because it shows that massive access to healthcare services, very strong prevention and massive testing. Russia has tested more than 36 million cases out of its 145 million population, can give us a good insight into the pandemic. However, looking at all the other aspects of the impact of the COVID pandemic, we have to learn lessons that will tell us absolutely more. Next slide, please. Next slide. Can I have the next slide, please? Unfortunately, I think that the next slide is not coming. Yes. So, impact of COVID is double. It is directly affecting health systems, and it is having an impact on the health status of the population. If we're looking at the health system, we would like to look at people first, at healthcare professionals. And there are various elements how the impact on healthcare workers of COVID is directly impacting them as individuals through psychological impact, through fatigue, through heat, stress, and skin damage when they are working with personal protective equipment, back injury from patient handling, slips, trips, and falls. The entire institutions, the healthcare institutions as structures have been affected because of the high numbers and rates of infection of health professionals, we are seeing entire wards, including intensive care units closed. We have seen a number of COVID-19 hospital outbreaks, a low number of bed occupancy because of the affecting and fluctuating healthcare workforce, including in countries where the additional work could not have been financially supported. It has, of course, had direct impact on patients and on visitors. Primarily, challenging is to establish patient healthcare workers relationship because of the barrier nursing that is necessary to protect everybody during a treatment of the COVID infection. So this is one of the most direct impacts of COVID that we see on the health service structures that we have to count on both in COVID and non-COVID wards. Next slide, please. Next slide. However, the World Health Organization has immediately early into the pandemic and with the spread of the lockdowns, conducted surveys in the member states, asking them about essential health services. What we have found is that the routine immunization services have been affected first. So while we had one communicable disease taking over the agenda of healthcare fully, all the other prevention and the major achievements that will influence achieving the target 3.2 regarding the mortality of newborns and children under 5 years have been hugely impacted because of the safety, because of the health facilities, because of the prevention of lockdown. If you look at it, outreach services of immunization have been affected in 70% of the surveyed countries. More than 120 countries responded to the survey, and facility-based immunization was affected in 61% of countries. If we are looking at non-communicable diseases diagnosis and treatment, what we have seen is that basically prevention, screening, outpatient and inpatient care, except for the most acute diseases and conditions, have been impacted in 69% of countries. This is why all the targets under the non-communicable diseases strategy, global strategy, will most likely be hugely affected, and we will see the overall impact only once the statistics becomes available after the first year of the pandemic that we are seeing. Family planning and contraception have also been affected in 68%. And as you have rightly said, these two services are clearly showing that the most vulnerable for the non-communicable diseases diagnosis and treatment, the elderly, for family planning and contraception, disproportionately women have been affected. Again, we might see a growing gap. Treatment for mental health disorders, a very highly vulnerable group, both for those with chronic mental health condition and with the mental health conditions that have been emerging due to COVID directly. Cancer diagnosis and treatment, hugely affected. TB services, we are having an ongoing assessment because that was one of the major achievements over the last period in terms of decreasing TB mortality. However, the multiple resistant TB, the extremely resistant TB, we will look at these impacts, and we fear that the pandemic of COVID will actually inadvertently affect also the TB pandemic. And the HIV/AIDS services, from prevention through treatment, through palliation, have been affected in most of the countries, whether because patients could not go and seek the necessary treatment, because of lack of access to medicines, or because of repurposing finances at the moment of the peak of the pandemic to treatment of COVID. Next slide, please.
Dr. Melita, can I request you to go slightly faster? That's all.
Yes,
it's a wonderful presentation.
These are the illustrations that I was speaking about on the essential NCD services, without staying too long in this one, but you can see the disruptions and the percentage. Next slide, please. Mental health, we are looking at a major burden that we are going to see in the entire world population, and you can see the reasons, starting from the anxiety and fear that the pandemic is causing, the physical distancing and lockdowns, the increased violence and domestic violence that we are seeing, the loss of job and unemployment, the increased risk behaviors, lack of access to treatment, and lack of services for persons with dementia. Again, across the entire agenda and across the board, vulnerable populations that we have identified first have been disproportionately affected. Next slide, please. Next slide. And if we are looking at policy measures in the countries of the WHO European region, you can see circled in the countries that we are looking at in the sub-region that have timely and rightly taken policy measures. So while we see the commitment of countries, unfortunately the slide does not show all the countries because the data were not available immediately from all of them. It is important to see that good practices can be looked at across the board. Countries can look to this policy monitor and learn from each other. Next slide, please. We are talking about building back better. We are talking about how we can actually change the situation for the future. And we would like to go back to the original looking at health policies and healthy policies as a tool to implement the Sustainable Development Goals by being committed to achieving universal health coverage, by addressing health emergencies, and by achieving health and well-being through all the multi-sectoral collaboration that is available for us. The COVID pandemic is both a challenge but an opportunity also to show that this matrix and that these structures can work together and achieve the SDGs despite the current challenge that we are seeing. Next slide, please. Next. The way forward, we have a transitional plan for countries, and this is the dual-track health system capacity that needs to address the peaks of the infection that we are going to see in the next days, but also all the burden that we need to address. We need to ensure access to vaccines and pharmaceuticals. We need to monitor the key performance indicators, and the SDGs are the key impact indicator that will tell us over a certain period whether we have been able to use the situation and to address the challenges. And ensuring universal health coverage is one of the key instruments that we have to look at in a wider context, because COVID-19 needs to be an opportunity for us to look back and to really go for universal health coverage. Next slide, please. Next. And allow me to finalize with the announcement. The regional director for the European region of WHO, Dr. Hans Kluge, has on the 27th of August launched together with the highest representatives of the European region a Pan-European Commission on Health and Sustainable Development. The aim of this commission is to rethink policy priorities in the light of pandemics. Our goal is to position health at the top of the political agenda within the Sustainable Development Goals and to strengthen the resilience of health and social care systems in the 53 member states of the WHO European region. But WHO is one organization. The United Nations works and delivers as one. And we believe that this pioneering initiative in the European region will actually spread faster than COVID, that we will be able to put health at the top of the political agenda, and that we will ensure that the network of leaders, policymakers, scientists, and civil society will identify, formulate, and address the key questions about the future of health and social care systems, not only the WHO European region, as we see from our commission, which is chaired and led by Professor Mario Monti, but that this is going to be one of the models and best practices that we can use globally and for the whole world. Thank you very much for your attention, and I wish you all a very successful forum.
Thank you very much, Dr. Melita, for really providing the strong basis for us, because we know that this is primarily a health crisis. And you really comprehensively covered all the dimensions. And you did so despite your very tight schedule. And I know that you put this together, but I really appreciate the effort that went into it and also the thought. And I think I can share the sentiments of the people who are hearing you, that you have now set the stage for us to really look ahead and move on to other presenters, but you have really given us a very strong foundation. So thank you, Dr. Melita. Now we move on to our next presenter, who is going to cover a very important area. We all know that women are disproportionately affected by this pandemic. Not only they are more likely to be in vulnerable employment, employed in sectors which have been most badly affected due to this pandemic, but they also take on the double burden of care. They look after older persons, childcare, and they're expected to also work. So I'm very happy to look forward to the next presentation by UN Women, which I believe is going to be a combined presentation by Ms. Sagipa Juseva, who's the National Program Officer of UN Women in Kyrgyzstan, and Ms. Diana Ismailova, who is the Program Coordinator for UN Women in Tajikistan. So this is a great partnership to bring a multi-country, regional, sub-regional perspective to this session. So, Ms. Sagipa and Ms. Diana, the floor is yours, and I hope you will make this a crisp, brief presentation. Thank you so much.
Thank you very much, Mr. Tata. I'm waiting for the presentation on the screen. Yes, you correctly mentioned about gender disparity, and I would like to say that women's well-being is very important, and emergency is a turning point to gender transformative interventions. Next slide, please. What are the key concerns? Load of unpaid and family care work increased during the pandemic of coronavirus and compounded by traditional social norms that assign all care responsibilities to women and girls leads to economic and other forms of dependence of women on their spouses and family members, and very often to domestic violence. Additionally, imperfect mechanisms of support and lack of formal navigation in transition to family and formal economy, unfortunately negatively impacts on women's right to fully participate in development processes. Next slide, please. Recently, UN Women has conducted gender rapid assessment, including Kyrgyzstan and Tajikistan. Next slide, please. In Tajikistan, 54% of respondents indicated actually psychological, mental, and emotional health issues, including stress. And there is a huge gender gap was noted. Women, 62% suffered more, and men, 46%. Next slide, please. In Kyrgyzstan, we can see that 21 and more of general population sample responded that psychological and mental health worsened. There was also observation on the vulnerability groups, and suspension of public transport caused major difficulties for 32 and more % of women. As for the vulnerable groups, the figures are terrifying. 91% of people living with HIV, 72% of survivors of violence, and 69% of representatives of ethnic minorities also suffered from those transport limitations. Next slide, please. As for the employment, in Tajikistan, you can see that actually employed women 35%, men 60%. On the date of collecting the data, it was June and May and June. Inactive women 64% and 37% men, and unemployed 1% of women and 3% of men. Next slide, please. As for the livelihood, actually, women more dependent on remittances, 27% if you compare with men, 18%. Also, women having pension and other social payments, 10%, while you compare with men, even 6%. And majority of men, 44%, mentioned that their main source of income was actually farming and raising animals. Next slide, please. As for Kyrgyzstan, 75% of women and 63% of men working on contract base moved to a remote work schedule. You can see that 47% of business respondents had strong negative effect on their businesses, and 13% of them had to suspend it completely. So only 6% of men and 8% of women are paid unemployment benefits. And the highest rate of the male income reduction is observed in agriculture, private business, and paid work. And women lost significantly cash income received from remittances. Next slide, please. As for the meeting basic expenses, women in Kyrgyzstan and in Tajikistan, they face difficulty in meeting basic expenses and might forego seeing health services. For example, 85% of women stated that they will face difficulties with paying for food, rent, and utilities if restrictive measures endured, and men reported 80%. Another 82% of women will have to exhaust their current savings. And there is alarming figure, 45% of women will forego medical checkups at all and seeing health services due to financial limitations. Next slide, please. Now you can see the slide with proportion of those people who did not know where to go in case of domestic violence. In Tajikistan, for example, married women did not know about how to proceed with the where to go and whom to approach. This is half of them, half of respondents. And in Kyrgyzstan, you can see that women entrepreneurs, they know much better about existing hotlines, but people affected by violence, it's about 30%. They know about existing hotlines. The rest do not know. Please, next slide. And about unpaid care work in Tajikistan, 70% of women are responsible for domestic household chores, management, shopping for family, and care for children. And of course, during the pandemic, the intensity of domestic unpaid work increased heavily. Women help in Tajikistan mostly with activities including financial management, shopping for family, and animal and pet care. Next slide, please. For Kyrgyzstan, women allocated also more time for cleaning, cooking, food service, and children care. Men allocated time mostly to the household garden works and purchases. And what is interesting that 35% of women responded that the partners did not help at all. The respondents, in particular women, faced with difficulties because of suspension of work of the public transport, while men were complaining less, 19%. Next slide, please. Here, I would like to pass the floor to my dear colleague from Kyrgyzstan, Sagipa Jasaeva, please. Thank you.
Can I ask you to please hurry up, please? We have one more presenter. Thank you. Otherwise, it's an interesting presentation. Thank you.
Thank
you. Доброе утро, коллеги. Я продолжу
Distinguished colleagues, I would like to continue Diana's presentation. Her presentation focused on the survey which we had in Kyrgyzstan and Tajikistan on COVID impact on various strata of population, but also, next slide please, But we also would like to talk about the solutions, possible solutions. And when we're talking about unpaid care work, that is a very typical situation that why women did not participate actively in economic life, and more than 50% are not participating in economic life because they're overwhelmed with household needs and household work. And here, out of the 67%, the breakdown in the employment are more as visible for women economically active age up to 40 years old, and then this gap is narrowing for women after beyond 40 years old, because we see that women are more focused on day-to-day chores in their households. Now, if we will have a look at the coverage of preschool and education for children, we see that kindergarten shrank significantly in the 90s. In Kyrgyzstan, only 24% are covered with kindergarten and preschool and educations. And now, if we will see the situation in 2019 in Kyrgyzstan, there we had a survey of investing into preschool and education where they calculated a hypothesis what would happen if state investments will go to the preschool and education, and this hypothesis will build on the scenario in terms of SDGs, which says about covering preschool and education of 50% from 0 to 3 years old, and from 100% from 3 to 7 years old. And the calculation showed that once investments will go to preschool and education, more employment opportunities will be then for children when they grow up. And the calculations also demonstrated then we have equal investments into preschool and school and education, and investments versus investments to construction. If there will be equal investments like 15 billion soms, then the in returning funds to the budget will be 26% out of original investments, whilst the budget proceeds on return from original investments to construction will be only 7%. So here we have absolute benefit for the state to invest into the preschool and school education, because the return from these investments to the budget will be significantly higher. And when we will cover children under 3 years old, there will be more than tax returns and return of investments overall for the government budget. Next slide, please. Apart from financial benefits, investments to preschool and education has a positive impact on other factors such as well-being of children and opportunities for good upbringing and further training and employment for them, decreased time in terms of unpaid home care. This is more typical for women because currently they are employed as housewives, and hence preschool and education will boost opportunities for women to be more highly paid and become economically active. It is also boosting various benefits once investments into preschool and education. It is a highly labor-intensive sector and creates more employment opportunities, and we also proved that this sector could generate more tax returns. At the same time, this scenario is possible only when the decision-making process will be balanced and decision makers will spread budget funds wisely. Now, next slide, please. We know that we're currently under COVID-19 stress, and it proves the necessity of cardinal changes in the governance. We are currently in the brink of various epochs. We know that life will never be the same, and the returning to normality after COVID-19 would not be possible based on all scenarios, pre-COVID scenarios. We need to develop new scenarios, hence. And the last slide, please. Next one, yes. And the challenges of our ever-changing time requires new approaches based on adaptive and technical solutions. We know currently that the government system is based on the technicalities which are rest on algorithms, normatives, and functional responsibilities and roles. As usual, this algorithm could be executed even without citizens' involvement, although they are the recipients of governmental services. But the crisis demonstrated that pure technical approach are not effective. When we are using only technicalities, we would not solve the situation for the better. That is why we need alternative solutions, and decision makers should be ready for exercising adaptive approach. That means openness and readiness to learn new opportunities. They require creativity, originality, all spectrum of those things based on IT and digitalization, like it happened in Kyrgyzstan during the lockdown. And this adaptive approach is impossible without attracting various strata of population, including, of course, most vulnerable one, like children, women, and elders, who could generate such creative solutions. And these solutions could be those one which would match the challenges of the current situation. The survey which I reported about says that the new solutions are possible, but only under the combination of technical and adaptive approaches. And the question is, are we ready for these new solutions? And I hope today we could discuss this approach, and on other dialogue platforms we're ready to answer your questions. Thank you for your attention.
Very much. It's been a really long and comprehensive presentation, but it was necessary because they presented primary data. So I thank Ms. Sagipa and Ms. Diana because they presented primary data, which is of interest. So, but I note that we have 5 panelists to follow after this and 1 distinguished presenter. So without much ado, I would like to introduce our next speaker. Our next speaker is Ms. Krista Pikat, who is the director of the UNESCO Almaty Cluster Office for Kazakhstan, Kyrgyzstan, Tajikistan, and Uzbekistan. She has held several positions with UNESCO and also has been working in the North and Central Asian sub-region. She will be focusing on the issue of youth. We know that youth face particular challenges in terms of their education and insecurity in terms of school-to-work transition in this context. So, Ms. Pikat, the floor is yours.
Thank you very much, Mr. Tata. I very much appreciate the opportunity for UNESCO to make the presentation at this session, and also, of course, to be one of the partners of the organization of this sub-regional forum. So my presentation focuses on the impact of COVID-19 on the education sector, actually globally, but also zooming in on Central Asia. But I would like to actually start with a small reminder that before the pandemic, the world was already facing challenges in fulfilling the promise of education as a basic human right. So, despite the near universal enrollment at early grades in most countries, an extraordinary number of children, more than 250 million, were out of school, and nearly 800 million adults were illiterate. And even for those who were in school, learning wasn't always guaranteed. We know that some 387 million, it is 56% of primary school children, were estimated to lack basic reading skills. So the situation wasn't brilliant before the COVID pandemic, and of course the COVID pandemic made things worse. Can I have the next slide, please? So the COVID-19 pandemic has created the largest disruption of education systems in history, affecting nearly 1.6 billion learners in more than 190 countries on all continents. Closures of school and other learning spaces have impacted 94% of the world's student population. And when we look at the financing of education, the challenge was already daunting before COVID-19, and the early 2020 estimate of the financing gap to reach Sustainable Development Goal number 4, which, as you know, concerns quality education, and it only concerns lower and lower middle income countries, was 148 billion annually. And this is in US dollars. And it is estimated that the COVID-19 crisis will increase this financing gap by up to 1/3. Next slide. From the UNESCO, UNICEF, World Bank National Response Survey on school closures, we see that the share and number of students not reached by digital and broadcast remote learning policies in Eastern Europe and Central Asia is 25 million. It is 34% of all learners. The crisis is exacerbating pre-existing education disparities by reducing the opportunities for many of the most vulnerable children, youth, and adults. For instance, those who live in poor or rural areas, girls, refugees, persons with disabilities, and forcibly displaced persons to continue their learning. And we also know that education disruption has substantial effects beyond education. These closures of educational institutions hamper the provision of essential services to children and communities. Such services as nutritious food, they affect the ability of many parents to work, and of course the increased risks of violence against women and girls that was already mentioned by the previous panelist. Next slide, please. The crisis has stimulated innovation within education sector, so we are happy to see innovative approaches in support of education and training continuity, from radio and TV broadcasts to take-home packages, and of course online learning on Zoom and other platforms. However, we see that many countries struggle to take measures to ensure distance learning for vulnerable populations. Again, looking at the UNESCO, UNICEF, World Bank survey, much fewer countries responded to this question. And among those who did, the reported measures introduced were not comprehensive when we speak about vulnerable populations. So an estimated 40% of the poorest countries failed to support learners at risk during the COVID crisis. But we know that children with disabilities who are already marginalized before the outbreak are not always included in the strategies, and they also tend to be those who are already lagging behind when it comes to sort of poor digital skills and knowledge about how to sort of use the hardware, and they also very often lack connectivity required for distance learning solutions that is used. Next slide, please. Now, turning to Central Asia, we see that the governments of Central Asian countries, and I'm now actually speaking about Kazakhstan, Kyrgyzstan, Tajikistan, and Uzbekistan, have used a mix of distance learning solutions, ranging from online learning through TV and radio programs to postal delivery. But it is also important to note that access to internet, ICTs, and sometimes even TV remains a challenge in parts of the communities in Central Asia. Next slide, please. Next slide, please. So here you will see the findings from the UN Socio-Economic Impact Assessment that was conducted by the UN agencies in Central Asia. And the key challenges in introducing distance learning programs in Central Asia actually range from sharp decline in quality that is recognized actually in all countries, through skills gap of teachers, students, and also parents or caregivers who have to support learners at home, inequalities in access, shortage of quality online content, and last but not least also to emotional unrest and anxiety. And the World Bank estimates that in Central Asia, due to the pandemic, the average learning levels will fall, and the share of children in early secondary education below the minimum proficiency level will rise. Next slide. So, at the face of the global pandemic, these are some of the measures that UNESCO, as the lead agency for SDG 4, took. You see that our response has been manifold, including the establishment of communities of practice for ministries of education and the educational institutions, the convening of policy dialogues with the participation of ministries, the development of distance learning content, and perhaps the sort of flagship initiative of UNESCO has been the establishment of a global education coalition. Next slide. So this global education coalition was initiated by UNESCO looking at the negative impacts of school closures on disadvantaged and marginalized children and youth. So the focus here is really on equity and inclusion. And the coalition is actually a partnership of a wide array of different partners ranging from UN agencies, civil society and non-profit organizations, technology companies, development banks, and the media. And what we aim to do is to actually bring all these forces together to work with the government, provide capacity building, provide quality content, leverage all the resources and knowledge and innovations available. And then the three priority areas for the coalition is to ensure girls return to school and promote digital skills, to provide professional support, training and collaborative platforms for teachers, and to bridge digital divides, reduce costs for students, families, and teachers. So it's the third dimension is connectivity issue. The next slide, please. So in Central Asia, my office in Almaty, we cover the 4 countries of Central Asia. We have tried to align our response also with the sort of global UNESCO's response, but also looking at the sort of specificities in the region. And through the policy dialogue and advocacy, but also capacity building and content development, we see that very often as we work in Russians and conduct all these meetings in Russian, we see that actually the interest has been wider. So we don't only work with the 4 countries in Central Asia, but we very often have participants from other Russian-speaking countries, such as the Russian Federation, Moldova, Armenia, and Belarus. So we are very happy that the outreach of our office's work has actually been wider. Next slide, please. So here I would like to briefly mention the new policy brief that has come out. It's a policy brief of the United Nations Secretary General. And the paper highlights that preventing a learning crisis from becoming a general catastrophe requires urgent action from all. This is a sort of main message of the policy brief. And there are a series of recommendations that are put forward in order for us to mitigate the potentially devastating consequences of the COVID-19 pandemic. And this is actually a call and recommendations that concern everyone, but of course, in particular, the governments and the ministries of education who are at the forefront of shaping the response at the country level. So the first recommendation concerns actually the return to schools. And here we want to emphasize that before we precipitate to go back to school, it's important for us to focus on suppressing the transmission of the virus and at the local and national levels. And then if we do already take the step to go back to schools, it's important for us to coordinate with all key stakeholders and of course including the health community. The second recommendation concerns and highlights the dramatic situation of the financing in the field of education, and it calls on governments to actually keep the levels of domestic revenue mobilization for or in support of education sector, make sure that the expenditure on education is a top priority, address any inefficiencies in education spending, but also make sure that the governments realize the importance of official development assistance for education, that these levels won't drop. Because if we see ODA dropping, then of course we are all in a disadvantaged situation and cannot provide the support to those countries which need this the most. The third recommendation concerns the resilience of education. And we actually call here to sort of support the education systems to better also cope not only with this crisis, but also with future crises. And we give a few indications as to, what are the areas that we need to pay attention to, concerning capacities development in risk management, leadership and coordination, etc. And the fourth and last but not least is, of course, the message about the response to the shocks that has made us realize that change is possible. So here we also challenge the governments and the educational stakeholders to take advantage of this crisis and build back or reimagine education systems better. And we highlight areas that need attention in this regard, such as addressing learning losses or preventing dropouts, making sure that we have employability programs in place, supporting teacher profession and teachers' readiness. But it's also about connectivity and barriers to connectivity and data and monitoring of learning and education and training. So these are the recommendations of the Secretary General policy brief that, as I said, are addressed to the governments. But of course, the United Nations system, including UNESCO and other agencies who work in the field of education, we are here to accompany you on this path. And I would like to conclude my presentation by the reminder that education is not only a fundamental human right. It is also an enabling right with direct impact on the realization of all other human rights. And it is also a global common good that is a main driver of progress in all 17 Sustainable Development Goals. So we have to make sure that education systems do not collapse, because this is also a guarantee that we have peace, prosperous and productive societies in the world. Thank you very much.
Thank you very much, Ms. Pickett. I think you've been really analytical and comprehensive, and it's really been quite very interesting listening to your presentations. It's in such a well-reasoned way. We've actually, friends, we've heard 3 really good presentations. I mean, we are very complimentary. Dr. Melita set the stage for us in terms of the health aspects of the pandemic. And then our UN Women colleagues really presented something interesting and new in terms of the analytical work that they did to assess the impact of the pandemic on women. And I think Ms. Pickett did a great job in linking evidence and policy and linking the global to the regional to national level action. So these three presentations have set the ground very well for us to move on to the next stage of the session, which is essentially the panel discussion. And we originally had 5 panelists. I don't know. I think one of our panelists is having some technical issues. Anyway, let me provide a little introduction, and I'll introduce each panelist before I invite them to speak. We have right now, I understand, 4 panelists online. I hope the 5th one can join us. My request to the panelists is, as soon as I give you the floor, please request to speak by clicking on the request speak button. And then once both the mic and your camera buttons become red, please click on them, and then you can speak and everyone can see you. Now, I wanted to open up for a series of questions after these very, very important presentations, but in the interest of time, I'm going to let them to the end so that we can compile questions both on the presentation and on the intervention from panelists at the end. So I hope you'll bear with me on that. Participants on YouTube, please ask questions on YouTube chat. We will be compiling them and giving them to our panelists or the presenters, whoever is the best one to answer. I kindly ask all panelists, please, I'm trying to do 2 rounds and keep a conversational aspect on. So please keep your interventions to a maximum of 3 minutes. If possible, we'll come around for a second round of 3 minutes so that you can cover whatever you want to say. The first panelist on my agenda was Ms. Ketevan Goginashvili, who was the Chief Specialist of Health Policy Division of the Policy Department of the Ministry of Internally Displaced Persons of Georgia and persons of and also in charge of labor, health, and social affairs. But I believe that she has certain technical difficulties. Is she online? Now, until I'm told, we'll move on to our second panelist. I would like to introduce Dr. Almaz Sharman, the president of the Academy of Preventive Medicine of Kazakhstan. He's had 30 years of experience in the fields of biomedical science, clinical research, and healthcare management. He has designed a methodology for integrated population-based testing of HIV, which has been implemented in several countries. So during the last several years, he's concentrated on healthcare management and academic medicine in Kazakhstan. Dr. Sharman, can you highlight for us, and this is my question to you, the challenges to the healthcare system in Kazakhstan and elsewhere in the sub-region that already existed before COVID-19, and how did COVID-19 exacerbate such challenges? So what's the impact on inequalities? The bigger challenge I'm giving to you is to explain this to us in 3 to 4 minutes, but we really look forward to your intervention. Dr. Sharman, the floor is yours.
Thank you. It's a privilege to join this important event. Thank you very much for the opportunity. The coronavirus pandemic has caused tremendous socioeconomic damage to almost all countries of the world, including Kazakhstan. The health of vulnerable people, the elderly, especially those with chronic diseases, has suffered the most from COVID-19. More than 80% of deaths from COVID-19 were among those who suffer chronic diseases such as obesity, type 2 diabetes, metabolic syndrome, coronary heart disease, and those diseases, those conditions could be prevented. To our deep regret, many of the society's best people have gave up their lives during this pandemic. They bought us time to rethink the meaning of health and well-being. There's a need for change from current disease-centric healthcare to a new paradigm that is based on primary healthcare and wellness-centric healthcare that is technology-driven and based on personal relationships with the social context. It is now important to focus on strategic priorities, namely disease prevention and primary healthcare, a crucial role of which in the prevention, early detection of COVID-19 and the management of post-COVID patients is becoming gradually more and more recognized. Modern technologies such as telehealth, machine learning, the Internet of Things democratize medicine, reinvent primary healthcare on the entirely new platform that is knowledge-based and technology-driven, technology-assisted. The future development of health must emphasize individual responsibility, personal relationship, and encourage sustainable solutions created by communities. Such rationalization would effectively mobilize public health resources to tackle the pandemic and prepare for future epidemic threats. In turn, social insurance and the competitive environment are designed to ensure universal availability of high quality and patient-centered healthcare. Now about children. Healthy behavior is established at an early age. The pandemic could be devastating for millions of children, jeopardizing their well-being in key areas, including health, education, and security, in which the nation's future depends. It's important to create a program, a comprehensive program, targeting health and well-being of children to achieve their physical, mental, and social well-being. We need to help them to form sustainable skills on healthy behavior, physical activity, rational nutrition, and proper hygiene. This should include the active participation of parents and teachers in creating a healthy family and appropriate healthy school environment, as well as special attention to the needs of children with special needs, with disabilities. Formation of true values in children aimed at health and quality of life will ensure the well-being and prosperity of future generations, their preparedness for the future pandemics and other potential threats. Thank you so much.
Thank you, Dr. Sharman. I think you've not only been precise and yet managed to be comprehensive. So my thanks to you for highlighting several important issues, including looking at the short-term and long-term solutions. So I will now move on. I'll move on to the next presenter, Ms. Gulmira Kazakunova. She is the chair of the Public Association Union of People with Disabilities, or Ravenstow, and the executive director of the Association of Disabled People, also serving as the project manager for the Central Asian Network of Women with Disabilities. Ms. Kazakunova, I was informed that you were infected and you have recovered from COVID yourself. So perhaps you are best placed to give us first-hand information from a perspective of a person with disabilities as to the specific challenges that you faced in this regard. How did it impact your personal life and the support services that you normally receive? Over to you, Ms. Kazakunova.
Здравствуйте. Спасибо за возможность рассказать.
To thank you for this opportunity to tell about situation of people with special needs. I have disability and I use a wheelchair. And based on my personal example, I would like to speak on behalf of 10,000 of people with special needs during pandemic. After the lockdown, my personal assistant stopped to visit me, and I was left alone without foodstuffs. I could not also remove garbage from my apartment, and I was also not able to withdraw money from the ATM machine, and public transportation was not operational, and I physically could not move during the first days since lockdown. Many people, women and men with disabilities, failed to access to medical services they required every day, and their condition respectively was much worse, and more cases of domestic violence were registered, and the only line of communication in my case was a telephone line. And then I got sick. That was the peak of pandemics in Kyrgyzstan. I could not reach ambulance, could not reach my physician had no needed medical stuffs, and I was suffocated basically. I was lying on my bed and could not do anything about it. Even if I was moved to a hospital, I believe I wouldn't survive there because somebody had to provide me personal assistance, and I did not want to jeopardize the health status of my personal assistants. And even if I moved to a hospital as a wheelchair person, I would encounter it with a problem of access in hospital to toilet, to other necessities, and I wouldn't survive again should I be there in the hospital during pandemic. As you probably heard, we have a lot of volunteers, and probably because of volunteers I survived, because they brought to me drugs, they injected drugs and to me, and oxygen concentrator was procured with the help of my volunteers, and this helped me to survive. And of course, there were many people with disabilities without such connections as I had, and they were just lying silently. And I was not tested, by the way. No one made tests, and I was not diagnosed officially with COVID, although I had all symptoms as a COVID patient. But many people with disabilities just laid in their apartment and died. I had no money to procure drugs, no assistance from other people for my fellow disability friends, and I believe COVID pandemic situation in my country revealed a very big gap in the social protection program in my country, and I believe that we need to introduce a special provision on emergency support for people with disabilities under circumstances like pandemics and other emergencies as well. Of course, the system of personal assistance, social assistance during pandemics basically was grounded to zero. And we survived only because of ourselves and because, of course, our dear volunteers. And if you have questions, I could answer them gladly. Thank you.
Very much, Ms. Kazakanova. I think your experience speaks more than 1,000 documents that we can produce. What you spoke today encapsulates all the things that we put out in guidance, but your experience captured it so wonderfully well. So I thank you for your experience, and we'll come back to you for your long-term recommendations. But we will move on to our next speaker, who is Ms. Saudat Kamalova. She's the chair and director of a public organization called the Central Asian Gerontological Center, and she's the chief gerontologist of the Ministry of Health and Social Protection of Tajikistan. And she is the best person to answer our questions on the impact on older persons. Ms. Kamalova, can you describe the indirect health effects of COVID-19 or the direct health effects on older persons? How do older persons cope with the situations, especially apart the deal with the issue of social isolation and lack of human contact, especially when they are under lockdown during the COVID-19? So over to you, Ms. Kamalova, for your response, and I really look forward to a crisp response within the time provided. Please a request for your mic so that they can be released.
Спасибо большое за предоставление.
Mr. Chair, for this opportunity to speak up, and I would like to answer several questions regarding the elders and their conditions and impact of COVID on the elders in particular. In my country, the situation is that after pandemic was announced by the WHO in my country, there was no announcement regarding the COVID threat in Tajikistan. Irrespective of this, the Ministry of Health and Social Protection established a task force which developed an algorithm of stage-by-stage implementation for preventing pandemic spread, and that is why in Tajikistan we did not have a panic per se. We closed down our borders, and the elders who were economically active, they were offered to a leave from their offices and recommended to stay at home. We did not have tough lockdown in comparison with the other countries, so we could see that in other countries the ageism, psychological suppression were widely spread, including physical violence, lack of services and caring were observed in other countries for elders. Such situations were not recognized in Tajikistan because elders who were living alone, they were covered with social care, and those who lived with families, they were taking support from members of their families. We also had support from mass media.
There were no information on new cases of COVID-19. So the hotline just recommended what doctors could be reached, so provided their phone numbers, and such information was published on the internet. In addition, volunteers were involved who provided big assistance. I would say that I was really pleased to see how the civil society became active. So there were so many groups set up on Facebook, and who help people, who help people, and people could place their requests for assistance, and so these people could be visited by volunteers. I would say that the elderly people during the pandemic are not cannot just transmit COVID-19, and so people and the community have to change their attitude to the elderly people. So they are victims. Elderly people are victims of COVID-19. So they do not suffer from non-infectious diseases, non-transmittable diseases, which can change their health condition. So the immunity can be just changed and modified. We're talking about immune deficit of elderly people. If we just add COVID-19, of course, it can deteriorate the situation and can be the reason for death. So at the very beginning, the Europe announced that COVID-19 was the reason for lethal cases of almost 95% of the elderly population. The reason for the high lethal cases was only their health condition. Thank you very much for your attention.
Thank you very much, Ms. Saudat. I think you kind of really, while giving a clear assessment of how the country dealt with it well, I hope in our second round we will ask you how you think things can be improved, even though things work well. But thank you very much for this initial sharing. I would like to go to our last panelist now, who is Ms. Gulshan Dolombayeva. She's an obstetrician and gynecologist at the Beloyarskaya Central District Hospital in Yekaterinburg. She's going to address, and she's also a chair of the Kyrgyzstan-Ural Joint LLC, an organization that works with Kyrgyz diaspora. So Ms. Dolombayeva is going to answer a question which intersects two vulnerable groups, women and migrants. And in many ways, Ms. Dolombayeva, migrants are particularly vulnerable and affected by the pandemic as they're unable to cross borders. Can you describe how migrants working abroad, as well as families in the country of origin, were affected, especially with reference to the North and Central Asian regions, and what are the coping strategies adopted by migrants and their families? And if you could kind of do a gender analysis, how this is differently affecting male and female migrants. Over to you, Dr. Gulshan Dolombaeva. You got 4 minutes, if you could answer within that, and I'll come back to you for a second round. Dr. Gulshan, can you please request for the mic and then click on the red buttons, please? Do we have a technical issue here? Could you? I would like our audience to bear with us for a minute. I think we have a request from Gulshan and she's coming online. Can I ask our technicians to help Dr. Dolombaeva come online, please? Looks like we are having certain technical issues. So can we go on? I will go back to Ms. Dolombaeva as soon as we establish connection. But I will, if Dr. Sharman is ready, I'd like to go back to him with a quick question then about Dr. Alma Sharman. I'm going back to you for your second round. I want you to tell me, with limited resources and increasingly aging societies, what kind of reforms do you see in order to ensure universal access to healthcare? So maybe we go back to Dr. Sharman to save time and then go to Ms. Gulshan after that. So Dr. Sharman, the floor is yours, please.
Yes, I believe that the universal access to healthcare could be accomplished and achieved through primary healthcare, through the development of primary healthcare. But as I also mentioned, the individual responsibility and community involvement is also very, very important. So now with technology that is available, that actually is not expensive. Like, internet is also becoming part of the human rights, basic human rights. It's possible to accomplish a lot with the access, with the knowledge, basic knowledge among population. So we need to change the whole paradigm from disease-centric, from egocentric approach when the doctors were owners of the medical knowledge, to population, to people, empower them, to make them more important, to make them more empowered to make informed decision about their own health. And I believe that with refocusing on primary healthcare, refocusing on individual responsibility and community involvement, this all could be accomplished. It could be achieved in the context of universal healthcare access. Thank you.
I think you've kind of reiterated and kind of strengthened the point made by a WHO colleague and others, the importance of universal healthcare, the importance of having a health systems approach. And I think the experience within our region is countries which have had universal healthcare have done much better in managing the pandemic, though, I mean, this is a generalized statement, but generally that seems to be the case, that you have good social protection systems, you're much better protected, good health systems and good, strong universal healthcare. So it's working. I believe, therefore, that we have Ms. Gulshan back online. So I am going to go to Ms. Gulshan Dolombaeva. And my first question to you, Ms. Gulshan Dolombaeva, is about the impact of this pandemic on migrants, especially if you can tell us the differential impact on male and female migrants and how this pandemic has affected them, and what are the different challenges that they're faced in this regard. So Gulshan, the floor is yours, and I'm very happy that you managed to come online. Oh, Gochan is not yet ready. Okay, we go on to the next. So I'm going to go on to Madame Kazakunova, who gave us such a personal experience about her challenges when, as a person with disability, from dealing with this, from dealing with her illness, and also kind of from her own personal example, provided us a window into the challenges faced by persons with disability. So, Ms. Kazakunova, please tell me what you would expect. How could we be better prepared to protect the interests of persons with disabilities for future pandemics? How do you think we can build back better? How can we include persons with disability much better in our pandemic and disaster responses, but more particularly pandemic responses? If you're ready, Ms. Kazakunova, I would like to go to you for your second question. Gulmira, the floor is yours. Can you take the floor again, please? There you are.
Можете перевести, пожалуйста?
We can hear you. Please proceed. Yes.
Can you translate your question?
I was asking you if how for the future, how will you rebuild, how can you ensure that persons with disability are better protected for future pandemic? How will you change the systems?
Ну, как я отметила ранее, что
Before, the program of social welfare should incorporate an item or provision on how to respond in such emergency situations, plus assistance for people with disabilities, how just to organize and to arrange social workers and the medical workers so that people with disabilities would not just stay behind without any assistance. And in addition, some auxiliary equipment should be envisaged so that the people with disabilities during isolation period or like quarantine could be more independent and more mobile. And I think psychological assistance to people with disabilities should be considered, because access to psychological services was sometimes regulated by their relatives, and people with disabilities were a sort of under certain discrimination, were affected by some discrimination. So there were some cases of violence, even if they managed to call psychological service. So there was a total control from their relatives. And of course, a lot could be included in such program. There could be a lot of provisions and programmatic missions and tasks, but they cannot be implemented without any finance or targeted finance. Therefore, even if there is a program in place, financing issues should be considered. Financing should be envisaged. So there should be finance source so that the program could be financially supported. Of course, how community of people with disabilities can just be involved in the development social welfare program. As you know, just flourishing of civil society means involvement of people with disabilities. We put forward a lot of recommendations, but regrettably, so this is most often this is only on paper. And I would say that to support this, I would say that after ratifying a UN Convention on the Rights of People with Disabilities, Coordination Council for Affairs of People with Disabilities was established under the Prime Minister. However, it has not started its functioning. Of course, a lot of issues could be included, like development of rehabilitation services, both medical and social, creation of social, creation of personal assistance for people with disabilities above 18 years old, or not only for those with disability who have a disability, who need disability equipment. So there should be an access provided for people with disabilities to public transport, for example. And I would say that people with impaired speech or hearing abilities, so they were left without any information. They were deprived of information. So therefore, like sign interpretation should be provided at all TV channels where needed. That's all from my side. I can just answer some other questions. Of course, implementation of the UN Convention for the people with disabilities rights should be implemented. But of course, we have a program, but it's still on paper. Thank you.
I think you've kind of highlighted on the importance of means of implementation, that we can have the best possible.
Я думаю,
It's going to be difficult for us. So okay, so we can move on now to one more follow-up question to Ms. Saudat Kamalova. What social protection would older persons need when we build back better? We note that many older persons in our region, maybe in North and Central Asia region, things are slightly better because you have social protection and pension systems. But is there any area where older persons we can do better so that older persons are better protected for future pandemics? So if you had to take 2 minutes or 3 minutes to tell us maybe 1 or 2 areas where we can set up policies so that older persons are better protected in the future and even in the later stages of this pandemic. So Ms. Kamalova, I would like to hear your response on this. You,
В Таджикистане. Алло, слышите меня? Хорошо, хорошо. Слышно меня? Я хочу сказать, что
I just wanted to say that the national development strategy of Tajikistan, which is designed based on SDGs, we have a special provision where elders are represented as a separate social group. It is very important because when we're talking about social vulnerable people, every group has different needs. Social vulnerable group has different needs. In order to beef up quality of services for the elders under pandemic and other emergencies, we need to have a separate database for elders, and the gerontologists, medical practitioners has to also update their database in order to know every person, every patient personally. But so far this database is just fledgling. And now for these countries like Tajikistan, it is very important to have a state program for and this program should be doable and realistic. At the level of civic society, we have self-support group for the elders, and under difficult life circumstances, they could support each other within these groups. We also have national traditions to help elders, which is also a very good protection for the elders, and hence they are not left alone with their own problems. The main predicament is high cost of medicines, and hence elders cannot have access to high quality drugs. And that is why I believe that we need to establish such a social fund or any other type of organizational structure which could offer some discounts for the drugs elders are required as essential one. Thank you.
Two very important issues, the whole issue of the tracking systems and data, and the second issue of access to medicines, which is very key. We still cannot connect to Ms. Gulshan. I think what we will do is perhaps we can have her on phone, but that's a different matter. But I think we will go on to questions from the audience in the meanwhile while we try to get Ms. Gulshan on the phone. Actually, we have one question that seems to really, we have consolidated a lot of questions. And one of the questions that have come up from the different members of the audience, and maybe Dr. Sharman is the best one to answer this, is the issue of vaccination. We know that vaccines they have been developed in certain countries already. Russia has already announced that it has come out with the vaccine, and a few other countries are in development of the vaccine. How can the North and Central Asian region come together and ensure that we have all countries and population in all countries have access to this vaccine? Are there any ideas that you can share with us, Dr. Sharman? This is a question that has come in from the audience. The second question is, how can governments leverage the digital revolution in order to revolutionize access to healthcare, whether it be e-health and other issues? And this has also been raised by Ms. Our panelist who also talked about older persons. So first, I would like to go to Dr. Sharman about the vaccination issue and also about using digital technology for health.
For this important question. Of course, in order to achieve what's called herd immunity, which assume will protect those who are not infected from COVID-19, it's important to vaccinate certain proportion of population. And currently there are 150 laboratories in countries currently working on the development of vaccine, and the process is unprecedented in terms of speed, and most of the about 30 groups, research labs now working on the third stage of clinical trials. Russian vaccine hasn't actually passed, hasn't even started third stage of clinical trials, third phase. But those vaccines, such as developed by Moderna, then Oxford Group, AstraZeneca, and Chinese company, and several others, now the third phase of clinical trials, and there are certain indications to assume that vaccines will become available. Some of them will become available for public by the end of this year. So the several countries that currently already have pre-contracted the development of vaccines, it's like most of them developed countries such as the United States and Japan, they already have a contract to ensure that billions of doses of vaccines become available. And of course, the crucial question is how about developing countries, whether the vaccines will become available to them. So I believe because they do not have technological capacity to develop their own vaccine. So I think that it is important now for the international community to work together to ensure the universal access to COVID-19 vaccine. And it's crucially important because it's a global pandemic. And even if some countries are somehow protected, still coronavirus will be traveling around the globe and continue infecting until it becomes endemic and seasonal infection. So it's important to work together to ensure that all the countries, developed and developing countries, have full access to vaccination. And the history knows good example, and when the international communities work together, such as smallpox vaccination that helped to eradicate smallpox in 1979, and the World Health Organization, UNICEF, played a crucial role in this. I feel optimistic on such opportunity. First of all, many countries now are very active, and I think biotechnology companies work very day and night on around the clock on developing effective vaccine that's supposed to be safe, and I think that there is opportunity to work together on providing the universal access to vaccination. With respect to technology, interestingly, due to pandemic, there's a tremendous development of telehealth solutions. We've been thinking about telehealth for many years. About 20 years ago, I initiated a telemedicine project in Kazakhstan together with partners in Alaska and Norway. At that time, it was quite difficult. Of course, we realized that there's not unsurmountable challenges, but still, it was very difficult, and most of them were due to insufficient development of telecommunication and digital technology. But now, situation is quite different, and not only telecommunication and mobile health technology becomes more and more available, they become very cheap. Not as even 10 years ago. They become cheaper and become more accessible to many people around the world. And the development of telehealth essentially has nothing to do with the government. It's basically people who have limited access to healthcare, to elective medical services. They have no choice other than communicate with doctors and use this technology. So this is a kind of unique phenomenon when the bottom-up approach basically prevailed, and the government has nothing to do is to liberalize their policies permitting telehealth and technologies involvement in providing healthcare.
Thank you. Thank you very much, Dr. Sharman. Of course, like you say, it is bottom up. The demand is being created, but governments in a number of countries have provided enabling policies. So without actually connectivity, you can't develop telehealth really, in a sustained manner. But I think the point that you make is very correct, that the demand also has to be created. I'll come back to you on a few other questions and to other panelists. And I would I don't know if Ms. Picat is online, I would also ask her to be ready, because I would like to also come back to her on the issue of connectivity and distance learning. But I would like to go now to Dr. Gulshan and rephrase my question using, when we face these challenges, we have to find innovative solutions. So my colleague, Natasha, is on phone with her, and I'm hoping that Dr. Gulshan will be able to answer our question through this relay about the impact on migrants or the pandemic on migrants, and especially migrant women. So, Dr. Gulshan, can you tell us what has been the impact of this pandemic on migrant workers, especially women as opposed to men? Are women migrant workers worse affected or the better, and what are the key coping strategies? Over to you, Gulshan. At last, I hope we can get through to you. Natasha, you can come.
Good afternoon, distinguished friends. I apologize for these inconveniences. For more than 15 years, I am a migrant myself. I try to give you information straight from the direct sources. Of course, migrants are very vulnerable. No one was expected such a dire situation. First of all, source of income was ruined since pandemic for the migrants. We are not talking about accessibility of availability of educational and medical services. The main basic need is to survive for the migrants and to eat something. More than 200,000 of my compatriots are migrants. 60% of them are women, and out of them, 25% are women with many children. We even have mothers with 11 children, and all of a sudden they were deprived of their basic income. Migrant communities had to establish a coordinating unit. We have to mobilize our volunteers. We got together as a single group and try to spread foodstuffs between each other. Although we did not have access at all to education, to medical services, because they had no chance to pay for internet connectivity. Second, access to education. We have a stereotype about insurance policy, and for migrants this is a very acute situation. We had many information awareness campaign that during pandemics migrants could have free of charge medical services, but because this information was not reached most of the migrants, they were under this stereotype that without policy they could not have access to medical services. And as a result, we see many cases, very sad cases, when young people and not young people died alone in their apartments, in their places, because they had no access to medical services, although they were available free of charge. They did not know about this. That is why civic organizations played very crucial part in assisting migrants, because civic activity was the solution. Migrants were left without attention from their respective governments. Kyrgyz migrants were deprived of, stripped off assistance from their respective governments. And I am very pleased that volunteers and others were supported us. Our mothers with many children did not have money to pay for utilities. They were left without electricity, and we had to pay for their bills.
And we were placing those mothers with big families even to other families and households. Thank you very much for this opportunity to talk. And I just want all the migrant groups, all the migrant communities not to be left behind. And so, we also just have enjoyed the support from Kyrgyz Republic and from local organizations. We're ready to work with the diaspora organizations to just strengthen our links with them. Thank you very much. It was I was really pleased just to take part in this forum, and sorry for these technical issues. Natalia, that's all from my side. Thank you.
Thank you very much. Thank you very much, Dr. Golchan, for making the effort. And after all, we all are living this new normal, so challenges are part of our task. It's how we handle it is the key. So thank you so much for making the effort, and I thank my colleagues for being innovative. We have a very serious question, and I would like to ask our UN colleagues who made some brilliant presentations. First, I'd like to go to our director from UNESCO, Ms. Krista Pickett. Krista, we are living in an environment of tightened fiscal space. Now, all of us are talking about increasing services, how we got to increase investments. So tell me, how in this situation as a head of an agency where you're asking for increased investment for distance education, how are you managing this? I mean, it's a very I know it's a catch-22 situation, but we'd like to hear your experience, and this is a question coming.
Thank you so much for this intriguing question. As you say, it is a challenging financial situation, from on all fronts. So, of course, education is one of the areas that is in need of continued investment and support. So, why should the countries, privilege and prioritize education? And this is what I actually try to respond to through my presentation, where I say that education is actually a human right. And now we also see that education is a precondition for the achievement of all 17 Sustainable Development Goals. So in order for us to continue on the development path that is sustainable, we need to start from education. And in the pandemic situation, when we see that education in its traditional forms, in schools, classrooms, no longer is possible, we have to prioritize also the necessary investments that make sure that we can continue education provision, not only to the privileged who have computers and connectivity and broadband internet at home, but that we also make sure that the most vulnerable parts of the communities are looked after. And this is why I think that the UN's work in support of their governance efforts is so important, because we can put our heads together, and this is also why the Education Global Coalition was formed, to really bring together all the stakeholders who understand the importance of education, and make sure that we negotiate with the technology companies to have, better and cheaper systems, that at least everybody would have the sort of basic tools that they need in order for them to continue to have education. And then, of course, UNESCO's message has always been that infrastructures and computers is not enough. If you have a nice computer at home, it doesn't necessarily help. We need people to have the skills. And this is why UNESCO stands ready to work with governments. We have programs that actually are targeting students, that are targeting teachers. And we are very much looking forward to this continued work together with member states.
Thank you, Krista. We have a couple of follow-up questions. Can you be online just before we come back? Because your presence has been very important. And so I'll go to our colleagues in UN Women to address the specific question. I think we have both of them here. You made a really comprehensive presentation with beautiful data. Did you explore the issue of women migrants? Is it covered there? And secondly, how do you see our governments putting in place gender-responsive recovery plans? Do you see that happening? And what extra needs to be done? Both, what efforts do you need from all stakeholders? Can we have a very brief answer on this before we move on to a couple of other questions? We will be adding a little time for discussion because of the interest. So can we move on to UN Women colleagues, please? It's about women migrants, and then secondly, integration of women, addressing women's needs specifically in recovery plans. Do we have Sagipa or Diana online? Otherwise, I'll come back to you later if that's fine. I think you have to request for the floor. Yes, we have Diana coming online. Diana, did you get my question? Yes.
Yes, sure. I wanted to clarify that actually UN agencies are preparing now the proposal for multi-partner transfer fund in order to respond to COVID-19. Yes, and one of the projects relates to migration and the problems related to the migrants' families and their wives. We have submitted this proposal, and it actually includes care work, reduction, redistribution, and recognition of care work, and multi-sided support to the the Ministry of Labor, Employment and Migration. Yes, so we are expecting the response by autumn, and it will be a full-fledged project in the pilot areas in order to support mental health, psychological support, to respond to SDGs issues, and to support migrant families economically. Yes, but another program relates to the framework on social and economic response of the country, and this relates to the economical support of women in terms of recognition and redistribution of care work of the rural women. And you correctly noticed that actually our rural women are left without support from their families because of the lack of remittances these days. And in the pilot areas, we, along with Pakistan, will also conduct programs on introduction of the special business package for the Ministry of Labor on how to navigate women from rural areas from informal to formal businesses. Especially it relates to domestic household servicing, to the home maintenance, and to home care work for children, elderly, and sick people. And this will be full-fledged support, including pilots on family kindergartens.
Thank you. Thank you very much, Diana. I think you've answered, I think the key issue, you addressed the particular vulnerabilities, not just of women migrants, but also women who are left behind when the men migrate. And so I think you've addressed both the dimensions, and it is particularly important for certain countries in the North and Central Asian region which are dependent on remittances.
Yeah.
Now, we have a set of general questions, but I would like to then move towards the end. I think we've taken a lot of extra time. I would like to ask any one of our panelists, and I'll be going back to them. Dr. Almaz, just 1 minute or 2 minutes for final thoughts from you in terms of recommendations, in terms of how we can build back better. Generic, you don't only have to talk about health, but generally on social development, what are the key recommendations that you would like to see coming out from this session? Dr. Almaz, if you're online, we would like you to reflect on it. Then I'll go back to the panelists also.
We live in a remarkable, extraordinary time, and this would be the time when we have to rethink a lot of things, not only the way how we approach to healthcare, but also education and social relationship, the issues of inequality. So this is a historic moment when we have true opportunity to establish a new norm in our relationship. This would be probably such as previous pandemics that changed the whole social structure and also reestablished the priorities. So I believe that the international community have to put together the new strategy, new approach, and probably get together to define new priorities in various fields. So I think that today's panel raised important issues. Of course, there are a lot of some private concerns, specific concerns, but the speakers are able to address many important issues. So I think that we need to still go through this extraordinary process and to come up with some solutions. I have some specific ideas, of course, in the area of healthcare that I already highlighted in my short presentation. But I think that we need to think a little bit broader to address those important issues. Thank you.
Thank you very much. Thank you very much, Almaz, for also being extremely. I thought Dr. Melita had logged off, so I wanted to check if WHO was online because there are a number of questions that we would like to ask her. But Melita, are you online? Because it would be great to have your input. But I was under the impression that due to a pressing engagement, Miss Melita, the WHO representative, had left. If she's available, then I would like her to answer the question about what WHO is doing to ensure universal access to vaccines. And I know they're doing a lot of work on this regard. And also, what are they looking ahead to universal access to healthcare in terms of building better? What do they think are the key priorities? Dr. Melita, I'm sorry that I didn't come to you earlier. I was under the impression that you had actually had some work and you had left. Well, my apologies for that, but at least we have you now to hear your final word.
Thank you so much. I was actually solving some urgent issues on the phone, but I could stay on because of the situation with my brother. Thank you so much for taking that into consideration. Indeed, access to vaccines for everybody. That means also for lower income countries, for everybody in the society, based on indications and medical health priorities and epidemic priorities, so to say, is the core of the WHO work at the moment. The ACT accelerator mechanism put in place is aiming to that. We have more than 150 countries expressed interest and commitments to the COVAX co-financing mechanism that should enable actually that there is financing available during the phase of research and ensuring vaccine distribution. The latest information is also that the European Union has joined also and committed more than $400 million to the COVAX. So we do hope that also the internal mechanisms, for example, from the European Union, are envisaging that when countries get their, I would say, purchased vaccines, they will also have the right and possibility to donate part of those vaccines to other countries. So there are parallel mechanisms at the moment going on. Gavi is involved, the Global Alliance for Vaccines, CEPI is involved. So we do hope that this unprecedented solidarity mechanism will enable to buffer the initial feeling that countries will tend to themselves first. The other mechanism is really to ensure safe, quality, and efficacious vaccines for everybody. And this is why WHO is very stringently putting forward criteria, having massive discussions with all potential applicants for the process of putting vaccines on the list of emergency use products, because if we want to go for a full pre-qualification, it will require approximately a year. However, the mechanisms for conditional registration in countries by major regulators, starting from the FDA to European Medicines Agency, all over the world, such mechanisms exist. That means that it's going to be a risk-benefit assessment of each of the products, ensuring that the product that is being released for emergency use in the pandemic that we desperately need, as Dr. Sharman said, we need to increase the herd immunity. We need to stop the transmission, and only with lockdowns, this is impossible. So there are parallel advocacy and concrete mechanisms in place. We see more progress than before, but it will depend on the solidarity of the countries and the willingness of the countries to participate. But we do see very encouraging signs from many of the potential developers and the industry that they will work on that mechanisms to make the vaccines available. However, we have to understand that vaccines are very challenging products. Nobody can say 100% how at the end of the clinical trials and the entire process we will have. The second issue is the mutation of the virus, the possible mutations. If it mutates in the critical elements of its genome, which means to change the transmissibility, the virulence, to change the pathogenicity, and to change the proteins on the surface that are enabling the organism to recognize it, we will have to go forward with research and development. But that's our avenue, and we are going for that. Thank you very much for giving me the floor. And now I'm disconnecting because now I have to leave. But I'm very happy that I could here take notes, because it's critically important, especially from the representatives of the civil society, that they have highlighted in the challenges that they have faced. Once again, thank you to ESCAP.
Thank you very much. And I think your intervention was very, very important. So I hope everything will be all right, and we will look forward positively to collaboration. Thank you so much. Thank you so much, Dr. Melita. I would like to then go back for final word. I would like to go back to Ms. Krista Picat for her final kind of 1 minute on what she would like to see as key recommendations. She's already been crystal clear, but if there's anything else that you want to tell us, please tell us now, because we really love hearing you. Yes, go on.
Thank you so much. I think that I already managed to sort of convey all the main messages, and as I highlighted, the recommendations of the UN system are in the UN Secretary General's policy brief on education. So I would invite everyone to go back and visit that. But perhaps sort of the three messages that I would want everybody to take away is, first of all, we need to remove barriers to connectivity, and take advantage of this situation to actually build back better, so to make our education systems more resilient, and perhaps also take or move the use of ICTs in the education process to a next level, so that it's not only a kind of a passive tool, but we actually use it to improve the quality of education, making it more interactive, also using more resources that are available online. Prioritize quality. And when we speak about quality, it's first and foremost teachers. So make sure that your teachers know how to use these ICTs, that they have the skills, that they have working conditions also that allow them to actually share the knowledge and wisdom that they carry. And the third message perhaps is leave no one behind. Make sure that you don't have girls, disadvantaged people, people with disabilities, and the other vulnerable groups in our communities suffer because of the crisis. And I'm sure that with all these efforts and with all our joint efforts, we will be able to have the education system survive and thrive. Thank you very much for this opportunity for UNESCO to partner with you on this SDG forum. Thank you.
Thank you very much, Ms. Picat. I think we've already heard from Ms. Saudat and Ms. Gulmira, unless they have something else to add. I think we have reached the stage in our panel where we have overshot our time by about 20 minutes. And I would like to thank all our presenters and all our panelists. Though we could not have Ms. Goginashvili because of technical reasons, I'm sure we will get to connect with her at a later time. I mean, to me, this panel showed how the richness of the development experience in the North and Central Asian sub-region, and the fact that it is very well endowed with people who are thinking, who are really working on mitigating the effects of this pandemic. And I have to say that in general, the North and Central Asian sub-region is doing better than many other sub-regions. Though there are challenges, they have done well. They are noting the challenges to the SDGs. And I'm sure working together, the sub-region is going to come out with a really good plan for recovering from the effects of pandemic by strengthening social protection systems, by providing universal access to healthcare, and above all, addressing the needs of all the vulnerable groups to ensure that no one is left behind. I hope that you will all join me in giving me a virtual hand of applause to all our presenters and panelists, and to members of our audience who have been here in full number despite the long session of 2 hours, 20 minutes, but time has really flown. I would really like to thank our team in the Secretariat and this wonderful interagency team of WHO, UNESCO, UN Women, and above all, my team in the team in UNSCAP sub-regional office in North and Central Asia, and my colleagues here in SDD, and anyone that I may have forgotten to name. I mean, they have been fantastic. It's been one of the more enjoyable experiences, and I'm sure that we're going to take these lessons and put it at the regional level. So thank you very much. Have a very nice day and stay safe, everyone. So we have come to the end of this session. I now hand over to the MC, Nataya, if there are any more updates, housekeeping from your side. Thank you.
Thank you so much, Srinivas. Indeed, a very interesting and engaging session that brought up so many issues, and the first-hand accounts of the illness, of the death, really bring the message home that this is a really tragic crisis that we're going through now that affects people in very different but severe ways. So from my side, a housekeeping announcement. Everybody who has joined us on YouTube, our colleagues will now post a link to the evaluation questionnaire. We would be very much grateful if you could complete that. We will also send this evaluation questionnaire to all registered participants via email. And then I would like to invite you all to join this afternoon's session, session 4. It will start at 2 o'clock Almaty time. And here we will discuss under the leadership of the Food and Agricultural Organization of the UN issues around sustainable food systems and nutrition. So again, I think this will be a very engaging session with a lot of different stakeholder accounts. Please join us for that one. Thanks very much, everybody, and see you later. Goodbye.